Hi, my name is Elizabeth. Today I'll be doing skull x-ray. So before I get started, I'm going to go get my patient. I'm going to verify their full name and their date of birth. Once I have verified the patient, I'm going to take them to the room and I'm going to ask them some history questions. So one of the questions I'm going to ask the patient any previous injury or surgery to their face or their head. If they had an injury, or if they currently have an injury as in right now, I'm going to ask them, is there any swelling or bruising or any pain to it? I'm also going to ask them if they had any headaches or anything like that. I'm also going to ask them any signs of losing their visions. Also, I'm going to ask them if they had any seizures or hearing problem or anything like that. So if they're female, I'm going to ask them when was the last day of their menstrual cycle. Also, I forgot to mention, also have to verify why are they here for their x-ray, what did their doctor tell them, and just ask them what's going on and stuff like that. So once I have verified all that information, I'm going to inform my patient to remove any earrings, any necklace, any hearing aids, any dentures, anything metal in their mouth, if they can remove it. Sometimes females will have elastic in their head, so we need to remove that, or any pins or anything like that they'll need to remove. Or any, if they have their hair in a bun, they gotta put it down. So once I have done that, I'm going to tell my patient to go ahead and lay flat on their back on the table. I'm just going to rise up my table until I hear it click. So the first exam I'm going to do is an AP axial. For this one, the SID is going to be at a 34. I'm going to have a tube angle, so it's going to be at 30 degrees cephalic. And I'm going to make sure that I'm detented and then I'm aligned to my cassette. It's going to be a 10 by 12 lengthwise. I'm going to, once I do that, I'm going to make sure that I shield my patient. And I'm going to start positioning my patient. I'm going to center 2 inches above the glabella. I've got to make sure that my OML and my MSAP is perpendicular. I'll also mark the image. I'll put a right marker, and then what I'll mark where I'll put my right marker, I'll put it where the light field is at, and then I'll come around the table and just make sure that my patient's head is not rotated or tilted or anything like that. Once I'm okay with my positioning, I will tell my patient don't move and don't breathe. For our next exam, we are going to do a PA. For the PA, the SID is going to be 40. There is no tube angle. Same 10 by 12 lengthwise. Make sure that I'm aligned to my cassette once I take off the angle. Also, shield the patient. I'm going to tell my patient to roll over to their tummy. Their forehead should be touching against the table. Once again, I'm going to center at the center at the exit of the glabella. I'm going to make sure my OML and my MSAP is perpendicular. Then I make sure that I mark my image on the right side on the light field. And once again, I'm just going to feel on my patient's head just to make sure they're not rotated or tilted or anything like that. And once again, I'm going to shield them. I'm going to tell my patient don't move and don't breathe. And then I can tell my patient they can relax. For the next one, we're going to do water. So for this one, I'm going to tell my patient to put their chin against the table so the forehead should not be touching the table anymore. For this one, it's the same thing. SID is 40, 10 by 12 lengthwise. Still shield the patient. For this one, I'm just going to make sure that I'm going to exit at the acanthion. So that should be my centering point. I'm going to make sure that my MML and my MSAP is perpendicular. Okay, once I've done that, I will just make sure that my patient's head is not tilted or rotated, and I'll also mark it as well. I'll put my right marker, and then I will just tell my patient don't move and don't breathe. For our last image, we are going to do a bilateral. So for SID, it's going to be 40, but this time we're going to do it crosswise, 10 by 12. And we're just going to make sure that we are centering 2 inches above the EMA. And then we're going to do our MSAP is going to be parallel and our IPL is going to be perpendicular. So for this one, I'm just going to tell my patient to put their head in a lateral position. So it's going to be like that. I'm going to put my left marker in front of my patient's face, but I'm going to put them in the top of the light field. That's where I'm going to put my marker. And just once again, those are my positioning points, center 2 inches above the EMA. Just make sure that my IPL is perpendicular and my MSAP is parallel. I'm just going to make sure that my patient head is not rotated or tilted. Sometimes there will be an occasion when you can try your best and it still be rotated, so you might have to put a sponge or towel just to make sure lift their head up. So once I've done that, I'll make sure that I have my shield on the patient, and we'll tell my patient don't move and don't breathe. And that's pretty much it. Thank you, and I'm sorry for stuttering. I was a little nervous.